presentation. So I would like now to introduce Mrs. Vanessa Laferrière, a clinical respiratory therapist specializing in sleep disorders. She excels at simplifying the complexities of CPAP therapy and adapting to her patients' needs. The conference on sleep apnea will address the causes, including airway obstruction and the impact of lifestyle, as well as the symptoms and morphologies at risk for this chronic disease. So we'll cover the health hazards associated with untreated apnea, such as diabetes and hypertension, and present medical solutions such as CPAP and dental device. So we'll offer an overview of how to recognize, understand, and treat sleep apnea in order to improve the quality of life of those affected. So, Madame Laferrière, Mrs. Laferrière, over to you for the presentation.
So, hi, my name is Vanessa. I've been a respiratory therapist for almost 10 years, and I've been working in sleep clinics for 13 years now. So today we are going to talk about sleep apnea. I'll just share. There we go. So what is sleep apnea? In the last 15 years, there's been more talk about sleep apnea in the media and around us. As respiratory therapists, we often get asked by new patients if sleep apnea is common or just a trend. The increased discussion about sleep apnea is due to better diagnosis and treatment methods. This improvement has led to more research showing how important treatment is and that it can affect a wide range of people. So before, sleep apnea was mainly associated with overweight, snoring men who easily fell asleep everywhere. Now we understand that sleep apnea can affect anyone who breathes. Sleep apnea is when airflow is not as smooth through the airways during the sleep as it should be. The left image shows a person breathing normally with air move down the throat through the windpipe into the lungs. The throat back is the narrowest part kept open by muscles when awake, but these muscles relax during sleep. The right image illustrates a person with obstructive sleep apnea or OSA, where relaxed throat muscles block air from reaching the lungs. This blockage signals the brain to wake the person up to reopen the airways, occurring multiple times at a night and often affecting several upper airway sites. Snoring can happen when air moves through this narrowed airway, causing throat vibrations. A reduction of at least 30% in the airway with microarousal or an oxygen desaturation is known as hypopnea. It's another type of obstructive event. So when we combine apneas, so the complete stoppage of breath, and hypopneas, the partial reduction in airflow, into one measure, we get what's known as a respiratory event index. This index is a way to determine how severe someone's breathing issues are during the sleep based on the number of these events happening per hour. If someone has fewer than 5 events per hour, the results are seen as normal. A count of 5 to 14.9 events per hour is mild, 15 to 29.9 moderate, and 30 or more is considered severe. While home tests are easier to use, they may not catch every instance of apnea because they don't monitor for very brief awakings or microarousals due to the lack of brain activity monitoring. So they don't have like the EEG. That's why it's also important to consider a person's symptoms and not just the index number when assessing their condition. So here's an example of a polysomnography test reading from the sleep lab. Each line represents at least one sensor. The bottom line shows a patient normal breathing and respiratory efforts. We can see the flow and the chest effort. Here is an example of here we have like a complete obstruction apnea. We can see that it's not the air is not going through despite of the patient respiratory chest effort. So we can see the flow and the chest just here. We can also see a decrease in oxygen right after the obstruction. This graph represents just over a minute of a patient's night. The analysis of his events will have to be carried out over the entire night. So here we have few personalities with sleep apnea syndrome. So sleep apnea can cause a number of symptoms. Here are a few of them. So the fatigue, depression, dry mouth in the morning or during the night, headaches, concentration issues, difficulties to wake up in the morning. During night, you can have like night sweats, nocturia. Nocturia is when you wake up more than once to go to the bathroom. Snoring, restless sleep, nightmare, gasping or choking sensation. In the office, we sometimes have patients who have a few very disturbing symptoms or others who have almost all of them. So everyone is different. This Canadian population-based study offers an updated portrait of middle-aged and older adults at high risk of OSA. So we can see that one on 5 people over 55 suffer from sleep apnea. The lower curve is for women, and the upper one is for male. You can see the impact of age and postmenopause on a woman. There are also more men with sleep apnea, but the gap between men and women narrows with age. So this study was carried out in the United States. The objective was to estimate the proportion of Americans over 65 who were at high risk of apnea and who had received diagnosis or treatment for OSA. The study showed that out of 1,052 people, 56 were at high risk of OSA. On that, only 8 had been tested. On those tests, 94 were diagnosed with OSA. Treatment with positive airway pressure was prescribed for 82% of participants with OSA diagnosis. So this makes us realize that a large portion of people with sleep apnea are underdiagnosed or untreated. Since advanced age is a factor that increases the risk of apnea, the mature population is being studied more and more. There are even guidelines adapt to sleep disorders in patients age 65 and over. So CPAP was the first line treatment for patients age 65 and over. It's less expensive and it showed more significant improvement of sleepiness. So here's a list of problems that increase the risk of sleep apnea. So we can see that PTSD, like you have a 70% risk of apnea. Just here, AFib, like a 50% risk. Asthma, 50% risk. Obesity, it's when your body mass index is over 30. So you have a 40% risk of suffering from sleep apnea. So here we have the evolution of obesity in the USA. Obesity increased risk of sleep apnea. So it's in 85, 87, 88, 90. So it increased during time. Here we go. So we can see that it's a real public health problem, and it will increase the number of people suffering from sleep apnea in the coming years. In our offices, patients are increasingly severe and young, which unfortunately continues this trend. So here we have the predictions for 2030. So it's almost one of two person in the United States will suffer from obesity. So we don't have the data for Canada, but we follow the same trend as our neighbors. So here are the links between sleep apnea and high blood pressure. In individuals taking 3 or more medications to control high blood pressure, the risk of developing sleep apnea is 80%. For people with high blood pressure under the age of 60, there's a 35% risk. So if other risk factors are added, the chance of developing sleep apnea increases. So nearly half of the individuals diagnosed with a type 2 diabetes will develop sleep apnea. For older individuals, this increases to 58%. If a person has type 2 diabetes plus obesity, the risk of developing sleep apnea increases to 86%. So sleep apnea and diabetes can reinforce each other. Sleep apnea can increase the stress and inflammation in your body, which can make diabetes more difficult to control. On the other hand, diabetes can increase the risk of health problems related to sleep apnea. The combination can lead to a kind of chain reaction in your body where inflammation and stress increase and worsening both sleep apnea and diabetes. So the screening and treatment for sleep apnea. So the level 3 sleep test is also known as a home sleep apnea test. Is a simplified device using at home to diagnose obstructive sleep apnea. It monitors breathing, oxygen levels, heart rate, and breathing effort. The level 3 test focuses on respiratory parameters, making it convenient for diagnosed sleep apnea in high-risk individuals without monitoring brain or muscle activity beyond breathing. So here we have a picture of the watch pad. it has been accredited by Health Canada this year, so it's really small. So the level 1 sleep test, or the polysomnography, it's the most comprehensive type of sleep study. It's conducted in a sleep lab under the supervision of a technician. It monitors a wide range of physiological parameters, including brain activity, eye movement, chest effort, muscle activity, heart rate, respiratory efforts, oxygen level, and more. This test is designed to diagnose a variety of sleep disorder and not just sleep apnea. It's providing a detailed picture of sleep stages and conditions. So there are various treatments for sleep apnea. The most common is continuous positive airway pressure treatment, or commonly referred as a CPAP. A CPAP machine treats sleep apnea by providing a steady flow of air through a mask to keep the airways open during the sleep, preventing breathing interruptions. So we have different kind of CPAP, and here are some examples of masks that can be used with this treatment. There are different choices on the market to suit every patient's needs. Another treatment that can be used to treat sleep apnea is the mandibular advancement orthesis. This orthesis advances the jaw forward to prevent blockage. The only way to confirm whether orthotic treatment is working is to repeat the sleep test. You need at least 8 teeth to have this kind of treatment. So the allergy also, it's always really good to control allergy. It will help you with other kind of treatment, and it also helps the snoring. So it helps you control the snoring. There are various surgeries for sleep apnea, but they don't all work the same way. These surgeries are considered when other treatments haven't worked. If someone's jaw is set back too much, they may get a maxillofacial surgery. A specific surgery called uvulopalatoplasty is good for stopping snoring. It's done under a local anesthesia, and it fixes issues with the soft palate collapsing. However, since sleep apnea can happen in different parts of the airway, this surgery doesn't always solve the problem, which is why its success rate varies a lot. So normally it's like around a 30% success. So thank you for listening. I hope I've helped you to learn a little more about sleep apnea, and it will be a pleasure to answer your question to the best of my knowledge.
Well, thank you very much, Mrs. Laferrière, for sharing your knowledge on this very important subjects. I'm sure that there are some questions from our members, and it's the time for the question and answer period. So as a reminder, you are now invited to ask your questions via the chat function, identified by the chat button on Zoom, and you can also raise your hand using the reaction option or the raise your hand at the bottom of the screen. So if you can remove the presentation of the screen, then we can see people.
Yes.
All right. And so let's see. Lynn, do we have any questions first on the chat? Oh, I see Mrs. Link. You have a question?
Yes, thank you. I have heard that the apparatus that goes into your mouth, the last one you discussed, will sometimes realign your teeth in a bad way. So could you talk about that a little bit?
It depends of the person, but probably the best thing to do is to speak with your dentist about it, because some people are at higher risk. So yeah, it's probably a talk that you'll have to do with your dentist at the end. It's probably the best person to answer.
Okay, thank you.
No problem.
Well, that was a short one. Any more questions by writing or through the or live? Or I know that presentation was crystal clear, huh? So, but it's your chance before we conclude. All right. So it seems that Mrs. Ling, you have a second question.
Yes, really, it's a comment. I was absolutely fascinated by the progression of obesity in the United States and how it went from this state to that state and the colors got darker. I was just fascinated by that presentation.
Yeah, me too. The first time I saw those data, it's impressive. It's kind of sad too.
I know, and it's evolved a lot. I know. Merci beaucoup.
Merci.
So if we don't have any more questions, so that this concludes our presentation. Thank you again, Mrs. Laferrière. That was a very, very interesting presentation. And I don't have anything else to add because everything has been said. So thank you all. And